The topic for today is we're looking at COVID-19 economics with an international perspective. And so we are we hear a lot about how this is an intersection of the economic questions and the public health questions. So we're addressing that head on today, and we have a really interesting couple of speakers for you, international speakers who we've invited. As usual, we're going to start with a quick situation update, and we're going to get that from James Merrick of GAL Research and also a member of ISAG. Over to you, James.
Thank you very much, Aoife. I'll just get the slides up. Great. So we've Acardia. Welcome everybody. And with Patrick's Day last week, we missed our situation update last week. So there's quite a bit to get through today, but we'll try not to hold up the core of the webinar. So first of all, we'll start with Northern Ireland. And 2 weeks ago in our last webinar, this sharp decline, if you look at the purple line here, we noted the sharp decline in case incidence in over 80s. And vaccination being a big part of that story. Now notice this is a logarithmic graph, so we're seeing some fluctuation, but at low levels. So in Northern Ireland, there's generally a good story here with trends downward. With perhaps the one exception is the slight uptick in the blue line of 0 to 19-year-olds, and we'll talk about children in the context of the Republic, because there's an important story there. So that's the general Northern case. The Republic, the case is more, the situation is not as positive. Among healthcare workers are vaccinated. Among non-healthcare workers, we're seeing an increase in cases. And again, we're on a logarithmic scale. Now, we have divided it up. And I forgot to mention, I want to thank Paul and all our collaborators for making this data analysis, rolling data analysis possible. I'm just putting words on the hard work. But in the Republic, we see a sort of flattening in the older age groups in terms of the age profile of cases. But the story really is in the younger age groups. And well, there's many things to say here, but I suppose what this is considered. I suppose maybe I'll first point to the data. So we see a strong rise in 1 to 4-year-olds in particular, and also younger age groups, which correspond with primary school children and correspond to the parents of all these groups. So this is consistent with the fears or concerns expressed by the group on the March 3rd webinar on reopening schools safely. We've had a situation where, say, Tullamore local electoral area would have 10x, an order of magnitude greater number of cases in the community than, say, Kenmare, a local electoral area, but the schools and creches were opened under the exact same conditions. And we see then this week a very large creche outbreak in Tullamore. And the theme of today's webinar is kind of first principle economics of this whole situation, and the sort of measures discussed by ISAG and in our schools white paper, CO2 monitors in every class, ventilation, local measures when case incidents are high. Yeah, they will cost millions of euros across the school population, but much less than the cost of having to shut schools down again. The benefits of education we all know about, but the cost of the measures that can keep schools as safe as possible are going to be dwarfed by those benefits. But unfortunately, they have not been put in place, and we're seeing the beginnings of a case incidence that aligns with those measures not in place, particularly in those areas where case incidence is already high. Now, Paul has done some interesting work on showing susceptibility. So a big part of the story here is B117. And we're seeing, while before children were not immune to the virus, but they were less susceptible to infection, with B117, we're seeing higher rates of susceptibility, and that's translating into the higher case numbers implicit here. Now, people might say, so what? Well, it leads to longer lockdowns for the rest of us and the cost of society. We, as Professor Scally has clearly outlined in our previous schools webinar, it's led to, we don't know the long-term effects of COVID in children. And third, we can say children don't get sick. And this is also a B117 story. Paul put together some hospitalization data. So the blue bars here are from pre-B117 era in the autumn, and the yellow bars are since January, kind of this B117 era we've now entered. And the y-axis here is hospitalization rates of confirmed cases. So we're seeing a big jump. So if you have an outbreak of 30 in a creche, you kind of have this expected value of one child in hospital, and if this spreads through the whole school population, we're a long way from children's vaccination. This is enough to really. It's very worrying. Let's put it that way. Very concerning numbers have come out in the last couple of weeks since our last update on this, and that translates from case number through to hospitalizations. Yeah, so that's the update on. I had one other thing I wanted to say, and I have let it slip. But no, we can come back to it later. So the big point is, oh yes, excuse me, I had one slide. So as I said, Angela Merkel and our Taoiseach has mentioned about B117 being a new pandemic, and the last few slides have really been a B117 story. And I suppose the other update that's happened in the last week is that we have had confirmed local transmission of P1 variant and B1351 variant, which have both been associated with bad outcomes in Brazil and South Africa. So that's kind of already out of the bag in Ireland. Can we keep it? Can we put it back in the bag? And that's the question facing us. And I suppose looking forward to future situation updates. Today's situation update, this move into children, was very much B117. Is our updates going to be more about these new variants? And so that's where we are with the update. So with that, we'll move into the core of the webinar. Thank you.
Thank you, James. It's very important to have that information. I think it's quite worrying, but it's very important that we are updated on the actual situation in the country. So we're going to hear again from James later, because he's going to also talk about the Irish context, the economics in the Irish context. But the main theme for today is we're looking at the pandemic through an economic lens. And our first speaker is Francesco Grigoli, who is an economist in the department at the International Monetary Fund and an adjunct professor at Georgetown University. And back in November, Francesco co-authored a paper entitled Protecting Lives and Livelihoods with Early and Tight Lockdowns. And today the topic he's addressing is the Great Lockdown, Dissecting the Economic Effects. So Francesco, you're very welcome, and thank you for joining us today.
Thank you very much for the introduction. I'll just share my screen. Okay, I assume you can all see it now. Okay, let me start off by thanking all of you for kindly attending this seminar, as well as to James and the coordinators for inviting me. Today I'm going to present, these are the main findings of a chapter of the World Economic Outlook that has been written back in basically October 2020 with data through July. And this is a joint work with Damiano Sandri, who's also a leader of the chapter, as well as with Chen Lian and Francesca Caselli. A lengthier discussion of these results can be found in a couple of papers I can send a link to. As I was saying before, this was written back in October, so the presentations may seem a bit dated, as it mostly is based with data up to July, yet it will show some results which we believe are still valid to inform policymaker decisions now. So the introduction is quite simple. As we all know, the COVID-19 pandemic has raised unprecedented health challenges on a global scale. And to contain the spread of the virus, most countries have resorted to stringent lockdown measures, which included closing schools, closing business activities, and sometimes even restrictions to the activities that people could do by leaving their homes. And meanwhile, economic activity contracted dramatically, which unsurprisingly affected a lot of the aspects of our daily life. So the chapter goals were first to shed light on the extent to which the economic contraction was driven by the adoption of government lockdowns, instead of just people voluntarily adopting social distancing for the fear of contracting and spreading the virus. Second, whether we can expect a rebound in economic activity when lockdowns were going to be lifted. And in fact, these two factors, lockdowns and voluntary social distancing, were both important. If lockdowns were the main factor behind the decline in economic activity, then lifting lockdown restrictions should have just jump-started the economy. However, when voluntary social distancing also plays a role, lifting lockdowns is unlikely to do the trick. Instead, the activity is likely to remain subdued as long as health risks persist. And third, we are using some novel data to look at whether the lockdowns affect disproportionately some segments of the population. In fact, back last year, there was this growing concern that the categories that were mostly affected by these lockdowns were women, who often had to carry over a larger share of the child caring, and as well as the young, who had less stable jobs and less stable occupation and were depending on more volatile income. We are going to also show some evidence on the effectiveness of lockdowns in containing the infections, and then we try to analyze whether tighter lockdowns have performed better than milder ones. So in this section, I'm going just to present some very suggestive evidence, broad view on whether lockdowns had a negative impact on economic activity. And here I start with the simple exercise of correlating the lockdown stringency with the GDP forecast error during the first 2 quarters of last year. And as you can see from the left-hand side the countries with harsher lockdown restrictions had sharper contractions in GDP. And the first two, this is the first preliminary evidence that lockdowns have negative impact on economic activity. A natural question then is whether these results hold only for GDP or even for a broader set of economic indicators, including, for example, parts of components of the GDP, industrial production, PMI, or unemployment. And when we do the same exercise, we basically find a consistent message, which is that lockdowns basically depress economic activity throughout a set of different indicators. And this is the case also when we control for COVID-19 cases as a measure of the fear that people face when they had to take the decision to go out or not. However, to better assess the impact of lockdowns on economic activity, I now turn to a different statistical setting. Here, the key advantage is that we now control for all those factors that are time invariant country characteristics, for example, as well as for global shocks. And given how quickly the virus spread at the beginning of last year and how fast the economy started to see a contraction in economic activity, we had to rely on higher frequency economic indicators, less conventional ones. And in particular, we used a couple of them. The first one is the mobility indicators by Google, which then became very broadly used in the literature, and also the number of job postings, which provide a better, or let's say a closer view on labor demand. We start to show some results with the mobility data. Let me show you the picture here. Formally, this analysis estimates what we call panel regressions for 128 countries. So it's a truly international perspective. The specification is pretty simple. We have mobility as a dependent variable, while on the right-hand side, we have the number of daily cases, which help us to track the stage of the pandemic, and a variable that captures the stringency of the lockdown, which is a measure constructed by the University of Oxford. And I have to say a couple of things about this without getting too deep into the specification aspects, but an important part of the discussion is that identifying the effects of lockdowns on mobility poses significant challenges. The first one being that lockdowns are generally imposed when the country's epidemic is entering an acute phase. And at that time, people are also more likely to reduce social interactions for the fear of being infected or infecting others. And these concomitant factors make it difficult to understand the extent to which the decline in activity, or in this case mobility, is a reflection of lockdowns or people behavioral changes. So here we adopt a simple identification assumption, which is that by controlling for the stage of the pandemic, the coefficient or the effect that we uncover about the impact of lockdowns on mobility should just reflect, should basically clean the picture from whatever effect is due to social distancing. And what we find is that in response to a full lockdown, mobility declines by 25% a week after the lockdown is introduced. And this effect, however, tends to fade away over a month, but the reduction in the effect is due to the fact that stringency of lockdowns also tends to fall over time. So initially, at least with data through July of last year, we observed lockdowns that were in place for only a short period. Here we do a similar exercise, and as I explained in the previous slide, lockdowns are inherently endogenous. So to alleviate these concerns, here we use a subnational disaggregation of the mobility data. And the idea is to focus on those countries that adopted national lockdown policies instead of different measures for each region, and examine the impact on mobility in those regions that were less affected by COVID-19. This approach has basically two advantages. The first one is that national lockdowns were generally imposed in reaction to epidemic in highly affected regions, at least at the beginning of the pandemic. Just keep in mind that here, this is a view that we had back in November of last year, October last year. And for example, take Italy, my home country, in which the government imposed a national lockdown in response to a surge in infections in some provinces of Lombardy. Therefore, national lockdowns were largely exogenous to the conditions in the regions with the lower virus spread. And second, the extent of voluntary social distancing was likely weaker in regions with lower COVID-19 cases. So this should allow us to capture more easily the role of lockdowns in curbing mobility. And what we find indeed is some consistent message with the previous slide, that mobility declines by about 25 to 35% in response to an increase and adoption of lockdown measures. So we have seen so far that lockdowns have a negative sizable impact on the economy, but our framework also allows to understand whether voluntary social distancing has an effect on economic activity that goes beyond the one of lockdown. And we find that an increase in cases triggers fear that eventually leads to a decline in mobility, indicating that voluntary social distancing indeed takes place as the virus spreads. Then, to compare the effects of the lockdowns to those of voluntary social distancing, we compute the contributions of these two factors to the reduction in mobility during the 90 days after the first case. And for the full sample, we can argue that lockdowns and voluntary distancing played a similar role in reducing mobility. However, the share of the decline in mobility explained by voluntary social distancing is larger in advanced economies, where about 1/3 of the decline in mobility can be attributed to lockdowns and the rest to voluntary social distancing. This is likely related to the fact that in advanced economies, people have better chances to be able to work from home, as the proportion of teleworkable occupation is higher. And people also have more savings to draw from when an epidemic hits and they need to face the temporary shock. And people also are less dependent on labor income, as the share of retirees is higher. So the analysis so far focused on mobility as a proxy of economic activity. As I was mentioning previously, we also use another indicator, which is the number of job postings. And we basically replicate the analysis, and we see that from the left-hand side chart, you see the consistent pattern with the one that I showed you before. Lockdowns have a negative impact on job postings. The results suggest that a full lockdown leads to about 12% decline in job postings. Second, as shown in the middle chart, infection here used as a measure of voluntary social distancing also reduce the number of job postings. And finally, when we use the estimates to compute the contributions of these two factors to the reduction in job postings, we find a message consistent with the one that we just discussed, that both factors are indeed important. These job postings data are particularly interesting because they provide also another dimension, which is key, the one by sector. This allows us to confirm that both lockdowns and voluntary distancing were key factors in explaining the drop in economic activity. So what we did in this part of the analysis to compare contact-intensive sectors, such as food, hospitality, and personal care, to less contact-intensive sectors, such as manufacturing. So you see in the left-hand side chart that we show basically that manufacturing jobs started to decline right at the time of the national stay-at-home orders, which suggests the importance of lockdowns for this segment of the economy. Job postings for contact-intensive sectors, however, started to decline before lockdowns, suggesting the relevance of fear and voluntary social distancing for those sectors. And second, in the right-hand side chart, we do the same exercise, but this time we impose the time zero at the time of the national stay-at-home orders were lifted. So we observed that jobs in all sectors started to recover slowly at the time of reopening, but they remain well below pre-lockdown levels, suggesting that simply easing lockdown restrictions will not jumpstart the economy until the virus is successfully contained. And so I've shown you so far that basically lockdowns and voluntary distancing have severe effects on economic activity. Now I will present you some evidence about how these effects are distributed across different segments of the population. The first observation compared to previous recession is that the current crisis affected women disproportionately, there are two main reasons for that. The first one is that the most affected sectors employ predominantly women. Think about in many countries, hospitality and personal care. And second, school closures have been particularly affecting working mothers, given the typical distribution of childcare within the household. To test whether the lockdowns have a differential effect by gender, we use data provided by Vodafone. In this case, they are only for 3 countries, only for Italy, Portugal, and Spain, which were all badly affected in the early stages of the pandemic. And another advantage of this data is that they are available with a finer disaggregation at the province level, which allows us for a much more granular analysis. So to study whether lockdowns have different effects across men and women, we adopt here what we call a regression discontinuity approach around the time of the lockdown. So in the left-hand side chart, basically I plot the percent of people moving in the age group 25 to 44, split by gender, around the time of the stay-at-home orders. And we focus on the age group 25 to 44 because these are more likely to have young kids. Each dot in the chart represents basically the mean of the data that is calculated over a certain number of observations. And time zero is the introduction of the stay-at-home orders. So the difference between men and women at the time was about 2 percentage points and was statistically significant. Then we want to dig a bit deeper and understand if this difference is driven by school closures or rather by women losing their jobs because of the lockdowns. So the issue here is that for Italy and Spain, the time of school closure coincided with that of stay-at-home orders, so it was difficult to test. However, this was not the case for 5 Italian northern regions, where schools closed slightly earlier on February 23rd, whereas national stay-at-home orders were implemented on March 10th. So we take advantage of this timing difference, and we repeat the same exercise But now the time zero is the day in which school closed. And we find that the wedge between the mobility of men and women, as you can see, starts to open up when schools close, suggesting that the ability of women to move is particularly affected by school closures, consistent with the idea that women carry a greater share of childcare at home. Finally, we take another look at these inequality aspects. We are interested now in testing whether lockdowns have different effects by age category. And what you see on the left-hand side chart is that stay-at-home order reduced the mobility of all age groups, from the very young to the elderly. But at the same time, we note that those in the 65 plus group were already moving less prior to lockdown. So what we do is then test the impact of lockdowns on different age groups in a regression framework, which allow to control for more factors, among which those characteristics that do not vary by province, or factors that happen in the same day for all the provinces. And what we find is that lockdowns have a stronger impact on the younger segment of the population. These results might have further implications also for inequalities, as young rely more on labor than pension, and young people tend to have less stable occupations, making them more vulnerable, or at least to lose their jobs because of the lockdown. So now I'm going to turn to the effect on infections, because it's no surprise that lockdowns have obviously a depressing effect on economic activity. However, this doesn't take away from the reasons for which they should be used, as the ultimate objective of these measures is to curb infection. So what I'm going to do now is to look at how effectively lockdown measures reduce the spread of the virus. And to do that, we rely on a similar approach to the one that we used before. This time, however, our dependent variable is the log difference of the COVID cases. And on the right-hand side, we have the lockdown stringency, which is our variable of interest. So we also control for other factors that are likely to have an impact on the spread of the virus. For example, temperature, humidity, the amount of testing, whether contact tracing practices were in place, and other ones. So as you can see from the left-hand side chart, at the national level, we find that COVID-19 cases started to decline 3 weeks after the adoption of a lockdown, relative to a no-lockdown scenario. And again, these are data we use for this analysis. We use data through July, and they seem to actually catch pretty well what happened even thereafter in terms of the timing that lockdowns have in order to have an impact on infection. In fact, this lag is consistent with the incubation period of the virus, the testing, and the time needed to obtain the test results and register them. After a month, cases are about 35% lower than in the case in which the lockdown was not introduced. The results at the subnational level, which are plotted here on the right-hand side, which again come from a stronger identification strategy that drops the regions with the highest number of cases, are very much similar, corroborating the results at the national level. So from a policy perspective, it is often interesting to understand these countries that adopted these lockdown measures early in the pandemic managed to control the spread of the virus better than countries that waited until the number of cases was higher. And this is, especially at the time in which the chapter was written, was particularly relevant, and as the virus was appearing to resurge in many countries. And to differentiate across early and late adopters, we used 2 alternative criteria here. The first one looks at the number of days that went by since the country registered the first COVID-19 case until the moment in which the country reached its maximum lockdown stringency. And the second criterion is based on the number of weekly cases at the time in which maximum lockdown stringency was reached. So what we find is that early adopters, as defined by these 2 criteria that I just mentioned, displayed better epidemiological outcomes 90 days after the first case. And these results are also confirmed in a cross-country cross-sectional regression that controls for other possible determinants of the virus spread, such as the ones we introduced before, like temperature, humidity, testing, contact tracing, and others. So the natural question is whether lockdowns entail a trade-off. And at the time in which the charter was written, our results about the effectiveness of lockdowns in reducing infections, coupled with the finding that infections can considerably harm economic activity because of voluntary social distancing, provided a kind of a new perspective on the cost of lockdown. The prevailing narrative, and I think so far is the same, that often portrays lockdowns as involving a trade-off between saving lives and supporting economic activity. But this characterization often neglects the point that lockdowns may lead to a faster economic recovery by containing the virus and reducing voluntary social distancing. And therefore, these medium-term gains may even offset the short-term cost of lockdowns. So in other words, lockdown may just pave the way for the upcoming economic recovery. So let me now turn to the last section of the presentation. Here, the response to COVID-19 cases, the response to the spread of the COVID-19, so governments implementing a range of lockdown measures. In our research, we were recognizing that countries often introduce different measures in a very rapid succession and generally followed a similar sequencing, from restrictions on international travel to stay-at-home orders. And these aspects were making it difficult for us to disentangle the effects of each measure. So while we could not say much about specific measures, we could still say whether it was best to rely on protracted mild lockdowns or to opt for more stringent measures. And as you can see from the left-hand side figure, what we find is that the introduction of additional lockdown measures has a weaker marginal impact on mobility once other measures are already in place. So this suggests that lockdowns have marginally weaker negative economic effects as they become more and more stringent. For example, something that could clarify this is that stay-at-home orders may have only a modest effect on economic activity if the government has already mandated workplace closures. So that is to say, the marginal effect is small. Conversely, we show that countries that impose tougher lockdown restrictions ended up with less cases than countries that took longer and adopted milder measures. So a possible interpretation of this is instead that, for example, preventing only a few instances of personal contact, such as, for example, by closing schools alone, is not enough to reduce the community spread significantly. So to summarize our findings here, first, we have seen that lockdowns and voluntary social distancing both contributed to the decline in economic activity. And in light of that, we argue that economies are unlikely to go back to the potential when, as long as the health risks persist. So it's critical to find ways to support economic activity while preventing the virus from spreading, such as enhancing working from home practices, promoting technologies to limit contact, such as, for example, contactless payments, facilitating the reallocation towards less contact-intensive sectors. Second, we have seen also that lockdowns tend to affect women and young disproportionately, and to contain the widening of gender and intergenerational inequality, measures such as unemployment benefits and paid leave seem to be the best solution. And third, we have shown that lockdowns do reduce infections and are particularly effective when they are introduced early in the pandemic and when they are tight. Given the economic cost associated, the economic cost associated with these measures and the need to control infection, policy measures, alternative policy measures such as at the time the use of face masks, cleaning protocols were strongly recommended. And finally, while lockdowns entail short-term costs, they can also help to pave the way for future economic recovery by containing infections and therefore reducing voluntary social distancing. Thank you very much.
Thank you, Francesco. That was really very interesting. And I think it's important to point out, that you're not a member of our group, but you're saying things similar to things we have been saying, that you're taking this you're analyzing it completely from just the economics point of view. And it's very interesting to see that the economic analysis says that the prompt reaction, the more stringent lockdown is actually better for the long-term economic recovery. I think it's very important to see that from the economic point of view, because as you say, this has been characterized as a lives versus livelihoods argument. Thank you, Francesco. That's very important. And I'm sure we'll have really interesting questions for you in the question and answer session later. Thank you. So our next speaker is Professor Anna Scherbina from Brandeis University. Anna is an associate professor there in the International Business School. And prior to joining Brandeis, she was on the University of UC Davis and Harvard Business School. She served as a senior economist in the White House Council of Economic Advisors, and she previously also served at the Federal Reserve and on the IMF. And Anna is going to talk about a cost-benefit analysis of COVID-19 policies. Anna, you're very welcome, and we're very happy that you were able to join us today.
Okay, thank you so much for inviting me. And I was actually happy to see Francesco's paper because I actually studied it when it came out, and I'm citing it in my paper. And thanks for the update on the Irish situation. So I am from Ukraine originally, and my husband is German, and both of those countries are doing a lockdown right now. And so this is the paper that also shows that you could do a cost-benefit analysis, and it oftentimes shows that lockdowns actually economically optimal. So, so let me just tell you briefly why I even got into this topic so early. I was at the Council of Economic Advisors from 2017 to 2019, and one of the projects that they worked on with the National Security Council was the project on pandemic influenza. So we were arguing that we need to modernize our vaccine technologies, that we need to actually invest a lot of money to get better vaccines so that they're more effective and that they could be produced faster than with the existing technologies. And so that work actually resulted in the executive order that came out in September 2019, modernizing influenza vaccines in the United States to promote national security and public health. And nobody anticipated a coronavirus pandemic. So we were all thinking that a pandemic influenza is going to come at some point because it comes around every 25 years. And it's very similar to coronavirus, is that people are asymptomatic initially, and it's very difficult to control. And so what we really worried about and what we really learned right now from this pandemic is that it actually resulted in a lot of changes that will help us deal with the next pandemic, which is inevitable, just because there's so much travel and the population density is so high and people live in such close proximity to animals right now that it will happen. But I think we're just better prepared because of that. So we had the big push, and we finally have the new vaccine technologies, mRNA technologies, that actually could be applied to produce vaccines quickly if pandemic flu strikes. And what we didn't anticipate at that time is that we had such good advances in information technologies that enable remote work and remote learning. So we always thought that there will be big bottlenecks with mass vaccinations, that even if we have vaccines that we won't be able to administer to many people, in particular because we have a shortage of medical workers. And this is what we're really experiencing in the United States. There are more vaccine doses available by far than what is being administered, just because of bottlenecks. And we argued it's really important to maintain stockpiles of personally protective equipment, which we didn't really, because after swine flu, they declined and just never got replenished. What we also learned is that we need to think carefully about supply chains, and if supply chains get broken, we need to really ensure that they're resilient. And finally, we advocated, and this is something that hopefully will get better now, international surveillance and information sharing across countries to help us prepare when we get the first signs that there's some kind of infectious disease going on. And so let me go back to this current pandemic. So this is different from pandemic flu because we know that in case of influenza, it has a U-shaped curve of what kind of people are affected by age. So the risk of dying is very high for children, then it declines and becomes very high for older people because older people have worse immunity. So the COVID pandemic is different, even though James showed some interesting slides that with the new variants, children are more affected. But based on the previous data, children are not very affected, but then the older adults get more and more affected by coronavirus and have a higher risk of being hospitalized and dying. But because children are not that affected, people kind of accept the risks because they get more disturbed when children are dying than when older people are dying. And as a result, I think it just creates room for a lot of negative externalities. If you don't really have centralized government policies, the younger people who have relatively low risk of a severe COVID infection, they're less careful and they get infected. So it was shown in the US when the strict COVID measures were lifted in the summer, young people got infected at high rates, and the infections then spread to older people. And the fact that older people could try to be careful in the end doesn't really help because it's almost impossible to prevent this contact between younger people and older people. And so we know from the Swedish experiment as well that voluntary social distancing just does not work. We need to get government involvement and we need to have some centralized policies to protect the vulnerable. Because in this particular case, the negative externalities of careless behavior of young people is very important. And so we know that how the governments intervene right now is with the lockdowns. And so you could do a cost-benefit analysis of any kind of non-pharmaceutical intervention policy. So you could start by estimating the expected cost of an infection, and then project the number of future infections and deaths with or without this policy, and see how a particular policy reduces the attack rate or the fraction of people who get the virus. And then you could compare the savings realized from such a policy to the cost that such a policy would induce on the economy. So in particular, in this presentation, I will talk about what if the US were to implement European-like lockdowns here. So of course, in the US, the situation right now looks pretty good. The number of cases is declining, and states actually lifting right now COVID restrictions. So Texas, for example, lifted all the restrictions and returned back to normal. And I'm actually going to argue that this is really the wrong thing to do. It would be actually more beneficial to implement European-like lockdowns in the United States as well and reduce the number of people who are infected in order to reduce the total infections and deaths before finally herd immunity is reached through vaccinations. So how would you proceed through this analysis? So you could calculate the incremental benefits from having a European-like lockdown in the United States in terms of the lives that we're going to save. And I will talk about how to estimate the value of life. The deadweight costs of medical care for the people who are ill and often end up in hospitals for a long time. And also people who are sick, they cannot work. So if you reduce the number of people who are sick, you will increase productivity and you will increase GDP through this method. So I modeled the pandemic curve going forward using the standard SAR model, susceptible, infected, recovered. And I modeled the effect of a lockdown by seeing what Francesco talked about, how European lockdowns were able in the spring of 2020, by how much they were able to reduce the basic reproduction number of the virus, the rate at which the virus spreads. And in European countries, the spread was reduced by 75%, according to the papers that looked into that. And then I calculate the incremental savings relative to the baseline scenario of not lockdown at all. So look at how many infections are going to be prevented with a lockdown of a certain duration and compare it to the baseline of no lockdown at all. The incremental cost of a lockdown on economic activity, I estimate to be about 37 billion. And this is based on several papers that looked into that by looking at the spring lockdown. So for the United States, it's 37 billion per week. So let's see what happens to a person. So in terms of estimating the benefits, let's see the expected cost of somebody who does get infected with COVID. So if you're infected, we know that a large fraction are asymptomatic. So those people do not suffer any medical complications, don't miss days of productive work. Unfortunately, they can infect other people. If you end up being symptomatic, then you could have any of those four scenarios. You could require no medical intervention and maybe just miss very few days of work. You could be a more severe case and have an outpatient visit and miss more days of productive work. Or you could be hospitalized but then survive, or you could be hospitalized and then die. And if you look at the data, what we have for the US and OECD countries, you see that hospitalization rates and infection fatality rates are very low for the young people, even though it's disturbing with the new variants, that's not the same. But they increase very, very quickly for older people. So somebody who's over 85 years old has the infection fatality rate, probability of dying, of 28%. And according to a number of papers, the meta-analysis of a number of papers, 40% of people are asymptomatic. But of course, if you look across the age groups, because people in the older age groups have more comorbidities, such as diabetes, high blood pressure, etc., the likelihood of bad outcomes increases with age. So the cost of the infection, when people get it, would increase with age. And the probability of dying obviously increases with age. So the question is how to value the lives of older people, because this is who disproportionately dies in this pandemic. So how do we value the lives of older people? And in the US, some politicians expressed this view that we really should not care about older people, that they should just sacrifice themselves to keep the economy going. But this is not how older people think of their own lives. They're actually willing to pay a lot of money to stay alive. So how do we think how to value people's lives? So one method to look at that would be the value of statistical lives. This is what we call it. This is to estimate how much people value their own lives, how much they're willing to pay for different interventions to increase the probability of staying alive. So for example, you could buy a bike helmet to, reduce the probability of death. You could pay for medical interventions to reduce the probability of death. You could demand a higher pay for riskier jobs, such as in construction, to get rewarded for the higher probability of dying. And this is how we could actually use the data to estimate how much people value their own lives. And you will see that the shape of the VSL, what is called, is the inverse U shape. So the value of children's lives is a little bit lower, then it increases for adults and starts declining again for older people. Another method is the discounted quality adjusted life years. And this is something that is not yet widely adopted in the US policymaking circles, but very popular in the UK and is being brought over from the UK. And this is kind of imposing a utility function on people, which we don't really know if it's based in reality or not, but just kind of valuing people's lives in terms of how many years statistically they have left and what is the quality of those years. So if you have comorbidities, then the quality of your life is lower than if you're perfectly healthy. So if you're perfectly healthy, your quality of life is set to 1. If you have some kind of chronic disease, it's going to be less than 1. If you're very, very sick, it's probably going to be very close to 0. And another question is how much to value each quality adjusted life year. So some think tanks advocate that it should be around 150,000 per per perfect QALY. And if you were to bring it to the same average value of life as estimated with VSL, it would be about 430,000 per QALY. And so if you look at VSL versus this high value of the equality versus the low, you see VSL has this inverse U shape, and the population weighted average for the value of life is 8.7 million. That's the value of life of an average person in the US. The equality, look at that, it's very high for children. It's almost 12 million for children, and declines very rapidly for older people because they have fewer life years remaining according to statistical tables, and because they have a lot of comorbidities, those life years are of a worse quality. So somebody who is over 85 years old would only have the value of life of 2 million. And if you use this much lower value, it would be only 0.82 million, less than a million. But of course, people in the US have a lot of problems with using this because, besides assigning a very low value to the lives of older people, it also assigns lower values to lives of people with comorbidities, such as somebody who has diabetes, even though they themselves probably would value their lives as higher, and also somebody who is just disabled, which a lot of people disagree with. But this is kind of central, what intervention policies to adopt. How much do we value the lives of the most vulnerable people who are older and who have comorbidities? So let me just tell you the current state of the COVID pandemic in the US for my estimations. So according to the Center of Disease Control and Prevention, we have almost 30 million recorded cases of COVID up to now. But if you adjust for under-reporting, because not every case is being reported, then more than half of the US population has probably already had COVID and is already immune. And currently, the number of cases is declining. So each infected person right now infects only 0.91 of other people. And it's probably because we don't have the new variants as prevalent here. And we made a lot of progress administering vaccines. So 128 million doses were already administered. And we're at the rate of about 2.5 million vaccine doses administered daily. And the good thing we're doing is that we are vaccinating, we're giving priority to older and more vulnerable people who are more likely to die. So this is really good. And our goal of vaccinating 70% of the population should be reached sometime by early August. So it looks okay, it looks good. But then the question is, should we still do an intervention similar to what we have in Europe? And would it really help in the US as well? And I showed the answer, yes, it will still help. So if you look at the upper figure in blue, this is the estimated savings from each week of the lockdown, similar to what we have in Europe, what it would have in the US. So if we impose no lockdown, the savings obviously is zero. If we impose 1 week of a lockdown, the savings would be about 250 billion, just because this 1 week of a lockdown will be able to reduce the number of infected people who will then infect others and save lives, save medical costs, increase productivity, etc. You extend the lockdown for 2 weeks, the savings will be even bigger. So with each additional week of a lockdown, the savings increase. But you see the curve has a concave pattern. Each subsequent week of a lockdown gives us smaller and smaller savings. And it's because we're getting closer and closer to herd immunity that we will anyways achieve through vaccinations. So we shouldn't really have the lockdown. If we wanted to save every possible life, we should really keep the lockdown until everybody is vaccinated. But economically, that's not the optimal thing to do. We should only keep the lockdown in place up until the time that its incremental benefit is higher than the incremental cost. So this is the incremental benefits here in the graph below with the red line. I depict the incremental benefits of each additional week of a lockdown. And the dotted gray line is the incremental cost, which is 37 billion a week. And you see that the first week of a lockdown will have a benefit of almost 150 billion. So definitely that is much higher than the incremental cost of this week to the economy. And something that's important to keep in mind, what Francesco said is that the economic activity is already depressed because of the pandemic. So the lockdown incremental will depress it by about 37 billion in the US. So the first week of the lockdown is really beneficial The second week will produce an incremental benefit of an additional 150 billion. But if you keep a lockdown in place beyond 3 weeks, the incremental benefits then fall below the incremental costs, and it's not optimal to keep it in the US that long. And so when I look at the different ways to value life, I estimate that with the VSL way to value life, which is how much people value their own lives, we should keep the lockdown in place for 3 weeks. The reduction in the attack rate going forward will be 1.81%. We will be able to reduce future deaths by 70,000 people, according to my estimations. And then that savings realized from the value of lives that we save, the medical expenses that we avoid, and the productivity that we will increase because people will be more healthy is 332 billion. With the D-equality that values the lives of older people at a lower number, the savings will be smaller. And with the low value, the savings will be lower still. And the lockdown should be only kept in place for 2 weeks. So, of course, when we think about a lockdown, we always talk about economic costs because we're economists, but we should also look at other literature, psychology literature and environmental economics literature. And there are a number of costs and benefits of a lockdown, which we don't really consider. But this literature actually shows that the lockdown has environmental benefits, and it reduces traffic deaths. It improves air quality, so people die less from asthma and similar diseases. And actually, the overall mortality from other reasons, such as flu, influenza, also decrease. So probably we should fold in those costs and benefits as well, and maybe a lockdown will actually seem less costly. And just to sum up, you could assess the optimality of any kind of non-pharmaceutical intervention with a cost-benefit analysis such as this. And even though the US picture looks good, still we could benefit from a European like lockdown here, even though I don't think that there's a political will to do this. And the lockdown, if we were to do it, should last between 2 and 3 weeks and will generate billions of dollars in savings. Thank you.
Thank you, Anna. That's extremely thought-provoking. I for one am not used to the idea of calculating the value of a life. It's not something that I think I see how, from an economics point of view, it's a way of looking at things. It's very, I'm sure there'll be some questions about that as well then. So now we're going to go back to James Merrick, who's going to sum up and maybe put in some Irish context as well, and then we'll get to questions from the audience. So please feel free to type your questions into the questions and answer button.
Thank you very much, Aoife, and thank you, Francesco and Anna. So I spent whole semesters on in climate change policy context. How do you value life? How do you make trade-offs? And so it's a big issue. But I think an important point there is the with this, what people might see as a kind of cold analysis of VSL type approaches, we still see the benefits of controlling the virus, and that's where most things come from. And then there's an element of a tight lockdown for a number of weeks, as opposed to this sort of long length. And we saw the benefit of this tight lockdown in both presentations, relative to this kind of long grind we're going through here. I want to share one or two slides, and then we'll push on to the Q&A. But I was trying to put a picture in my head of this idea, and a lot of the debate in political commentary, newspaper commentary is, oh, lives versus lockdowns. Okay, we'll open bars and restaurants this week. We'll improve livelihoods a bit. Okay, but we're going to take a loss in lives. And the kind of discussion is, how do we find a point in this trade-off? But really, it's the wrong question. Really, the role for government, and as outlined, for all the reasons outlined by our speakers, I think excellently, the role for government is finding the push. How do you push out to these other contours where you're improving lives and livelihoods? And of course, the great example, I think, is the kind of Eastern countries, the Asian Pacific countries who have had better better economic outcomes, better lives, and less lives lost. I've spent a lot of time with climate change economics, and there's a couple of things I wanted to point out quickly. One feature I see is in climate change, and I see here is in the world of, okay, something can be aggregate benefit, kind of a net benefit on aggregate, but the costs and benefits are distributed. There's winners and losers to get to the societal benefit, and that's, I think, a big factor in the whole COVID debate. You know, for example, airlines are under pressure. Travel is under pressure with COVID restrictions, but and so very concentrated costs, while the benefits to us all trying to live a normal life and resume normal economic activity are diffuse across everybody. And so we have this challenge. An important point is where, and this is in climate change, like, where do the unknowns lie? We've never lived in a world with 6, 7, 8 degrees of warming. What could be triggered? And similar, the variant story that we pointed out to earlier, could we get variant? Where are the unknowns? Where are the risks? And there's this tail risk that a variant will come that will send us back to square one, get around our current vaccines. The third thing is in the climate world, we see it's incredible how solar, wind have progressed over the last 10 years more. It's hard to walk down the street now without seeing an electric car pass by. So technology is wonderful. It makes it easier to solve the problem. And in the COVID world, vaccines are wonderful. It makes it easier to solve the problem. But they're in both worlds, they're part of the solution, not the silver bullets. And Francesco touched on this, and I think it's really important, and I try to touch on it with the school stuff. It's the value of smart targeted action. In climate, we can all lock down as well and reduce emissions, but it's tremendously expensive. It's better to substitute out. It's better to substitute out polluting technologies with clean technologies. And yeah, there's a whole world there. But the point is the value of smart targeted action. Like Taiwan, example I love is they sent out FFP2 N95 masks to every household. Like, what's the cost of a mask relative to the cost of what we're going through? It's pittance. And a proper mask, a better mask. And these are the things, there's lots of smart targeted actions that can be done. A laser focus on airborne transmission, as they've had in some of the Asian countries, just to make the costs of getting where we need to go. On the Ireland, I think it might be a topic for a separate webinar. But we have two economies here, essentially. We have kind of the exporting economy, and that's done well. Like, an incredible fact is that the income tax returns in Ireland in 2021 January were higher than January 2020. And a lot of the higher earning people who pay most of the income tax are in these export oriented industries, while the domestic economy, small businesses serving each other, have been under terrible duress. And so, I suppose as Anna showed, the European style policy of lockdowns, okay, we've saved a lot of lives, and when you put any number on that, when you put the sort of, it's incalculable, but if you try and put numbers on it, the value of the lives we've saved has been huge. We've had economic benefits of the policy we've taken, but could we do more? And I think that, when we look east in particular, we see options that could improve that trade-off. That could basically improve lives and livelihoods. So I want to and I suppose the last thing I want to say, but this value. So there was a paper in the last couple of weeks that showed the value of vaccine, 2-dose vaccine was like, in I think the United States context, but $5,000 or $6,000, while the cost of the vaccine is $5 or $6 or $10, $20 or whatever. And the point is, if we can put together a public health system, a public health infrastructure, and all those things we talked about in this group, whatever it costs, the millions it costs, it's minuscule compared to the value if it allows us to reopen society safely. So the other point I wanted to emphasize from the talk is I think it's really important that our speaker said about in this counterfactual world, the people who are against lockdowns in this part of the world, they say, oh, just open up. But the counterfactual world where it's open up, we don't see, it's not going to be normal. People, when they start seeing death and morbidity around them, they're going to change their behavior, and it's not normal. So the counterfactual isn't necessary in the lockdown societies. The counterfactual isn't what people might think it is. So there are a couple of things. So I want to go to questions, Nessa asked us, what do people think about universal basic income in these circumstances, and indeed permanently? So I think permanently is a separate question. It's a whole world. It's a fascinating economic question, but in terms of income supports through this time, I'd like to ask the presenters, Francesco or Anna, did they have any comments on this idea and maybe what COVID has, and if they do have any projections of what COVID is showing about that going forward?
Yeah, I can give maybe a quick reaction to that. I agree that on the permanently, it's more of a political issue, but I guess that I'm more of the idea of targeting this type of intervention of an income supportive measure. It comes out pretty clearly from the presentations that there are segments of the population that are hit badly compared to others. And that's also why one of the recommendations we came up with at the beginning of the pandemic was to try to target, to contain the types of inequalities we were trying to point out, such as the intergenerational one and as well as the gender inequality, to try to tackle those with type of interventions such as unemployment benefits or a paid leave for parents. That could be considered rather than universal basic income measures.
Yeah, I would like to second that. I think there's so much resistance in the US to the idea of a lockdown, just because there's no safety net at all, unlike in Europe. And all of those COVID relief measures, they really help. But I think it's just a separate question of the universal basic income, but I think we need to have some kind of support for people to be on board with the idea of a lockdown.
Thank you very much. That's great. So a question for Julian, who's one of our panelists, actually. So I'll ask Julian to turn on his audio and ask the question.
Yeah, hi. Thanks to the presenters. It's maybe more related to Francesco's presentation, but can be answered by anybody, really. There's a consensus among economists, I think, the way I see it, that early lockdowns that are tight can have economic benefits for growth and afterwards. Why is it then that Europe has resisted that? It seems that the benefits of a good lockdown to clean the virus, to clear it from the countries, are quite obvious. People watch the concerts in New Zealand and stuff like that, but yet it seems that governments seem to have said, okay, economic growth is not our main priority here, or something like that. How do you explain that? You'd think it'd be obvious, you know?
Yeah, my perception is that, again, at the time in which the pandemic started, it was not so obvious what was the perfect measure to deal with the situation. And I'm sure that if you ask other people, they would tell you that other type of intervention may be more targeted, more lengthier, based on age groups, based on regions are better. So just to point out that there is a lot of discussion about what is optimal here, but it's a tough question to answer. But my sense is that there is always some sort of political economy reasons for which you want to fight and a complete lockdown. I mean, there's the economic costs associated to that are large, and the epidemiological gains or the life gains are not so clear in the short term. So I think there is just some sort of myopia playing in the head of the policymaker. Yeah, I don't have a better answer for that, but to me, I would reconduct that to political economy arguments rather than clear cost-benefit analysis, which seems to be pretty clear on the fact that tight and short lockdowns are better off. maybe Anna has a better view on this.
Oh, I agree with you. And I think it's also a behavioral issue that people face, that the costs they feel immediately, because some may lose jobs, and women, they have to maybe quit their jobs, but the benefits come in the future, and they're really hypothetical. It's just a lower chance of getting the virus in the future. So people probably have time estimating, understanding all the statistics, and seeing something that is hypothetical. And also another thing is the negative externalities. So if you yourself are young and have a very low chance of dying or having a severe illness, you feel the cost yourself, but maybe you're not really willing to make a sacrifice for others. Maybe that's something that plays a role as well.
Thank you very much. They're two great answers, and I think this negative externalities point really resonates with me. So yeah, a couple of questions from our audience. So Christopher asked us about 2 to 3 weeks of proper lockdown, and so I might turn this question a little bit. When you define and you might have said this, when you define I'll ask two parts of the question: how you define lockdown, how stringent the lockdown in your analysis was, and second thing is Christopher's point was about, could we do regional opening up, essentially open up some communities where the virus is, because the main message is, if we get the virus down, you open up economic possibilities. So Christopher's point is, can we do regional opening? And then of course we get in, there's the technical issues of how you manage to stop the virus coming in again to those regions. But so Anna, two questions: is the stringency of the lockdown analysis, and second, any thoughts on kind of local reopenings or any of those sort of ideas?
Yeah, I think that's a great question. And I think I was basing my analysis on the spring lockdowns in Europe. So as something as strict as that, but now that we'll learn so much more about the virus and how much the spread could be prevented with face masks, I think we understand that the economics of it could be improved. We could make a lockdown more efficient in terms of stopping the spread of the virus, but less costly to the economy. So if people can work outdoors, we could let them work in construction. But if you are forced to be inside some poorly ventilated space, that's something that we have to stop, like church services or something that puts a lot of people in the same location. And I think that's also something that could be geared to specific locations. If you are in a rural area and you kind of keep it under control, as long as you limit travel in and out of this area, you could also open up selectively. So there's definitely a lot of room to improve what we had in the spring and to lower the costs to the economy.
Yeah, I have little. Just that I have little to add on this. I mean, in our analysis, the full lockdown, actually I forgot to refer to that, but was basically, it was very difficult to understand what economic measures drove to what, because they were all applied at the same time. And again, in a very rapid succession and very similarly across countries. So disentangling the effects of single measures was particularly difficult. However, we as a full lockdown, we basically meant the effects of full closure. So implementing all school closure, business closure, stay-at-home orders, travel restrictions, and so on. But I fully agree with Anna that the kind of measures that were implemented later on and that proved effective, such as the use of face masks or even the contactless payments, were key things. I mean, I know, for example, here in DC, they were pretty fast in implementing contactless payment systems in restaurants. So basically, you had no interaction whatsoever with the waitress or the restaurant personnel. You were ordering with an app and you were paying with an app, and everything was smooth. Now, this couldn't happen right away. I mean, it took time, but I think that the world has changed over the pandemic, and some of these conclusions also, or policy recommendations, should reflect those changes.
Thanks a million. That's great. Pauline has a question about how do we encourage various sectors, retail, hospitality, entertainment, manufacturing, childcare, etc., to prepare plans for how to safely open. I actually, my first response, Pauline, would be to say, look at this, the ISAG school reopening plan, because it addresses like safety measures that will hopefully allow groups of people to gather safely as necessary. Just to our two guest speakers, have you? Yeah, well, I'm going to pull out one, hospitality, because that's a big thing in Ireland. Traditionally, it's a big part of our culture, and it's obviously hurting a lot of people. That whole world is shut off at the moment. And have you any thoughts on sectors like that? Because obviously there's a different economic effects across individuals. What is there an economic answer here to people working in those sectors, for example, and people who are consumers who are denied access to those sectors?
Well, so I can just maybe say that there's some studies in the US of safe school reopenings. So if you do it safely, I think that the transmission rate is very low in schools if there's proper ventilation, but a lot of states did it and they did it not safely. And as a result, infection rates have increased. I don't know if any studies on the hospitality industry in the US, maybe there are really some guidelines that as long as you abide by those guidelines, you could safely reopen. I don't know, Francesco, do you know?
Yeah, I'm not aware either of those type of studies, but yeah, I think that there are conditions that you can put in place to operate schools and try to keep the contagion relatively low. There are some other professions or sectors such as personal care, which require inevitably some contact that are much more difficult to deal with, and there I don't have a proper solution. But these, as we have seen also in the presentation, these are the sectors that are more likely to suffer and to continue suffering as long as the virus is contained.
Thank you. So I'm going to call on a couple of our panelists, and we're getting to the end now. And so I want to thank everyone for bearing with us. I think we've learned a lot. I might call Simone first. Simone, you had a comment on. Well, I'll call you about this distinction maybe between international trade and the domestic economy.
Well, I have an innocent question, I suppose. My worst two in my commercial law degree were in economics and accounting, so it's not my area. So maybe this is helpful for other people. When I talk to my friends who did study business and say that under a zero COVID approach and elimination approach, 2021 could be the year of the domestic economy in Ireland. People could go on holidays to the west of Ireland. The theatres could possibly open in Dublin. Some big Irish artists I know would play residencies and people would buy tickets to go and see them. And my friends who are my betters in economics say that sort of money is no use to Ireland. It just goes round and round in a circle. We entirely depend on the international economy. And when I've said, well, surely that's still going, because we know that those of us who can work from home from multinationals are okay. The small and medium enterprises, people in hospitality, entertainment, the arts are destroyed. This would still happen, that money still travels. And even with hotel quarantine, you have trucks coming in and out and freight coming in and out. And they don't seem to be able to answer that for me. So I don't understand that at all. Maybe you could help me to understand that.
So thank you very much, Simon. And my first reaction is about like for example, we could vaccinate like all our so there's two things about I have a small business and most of my clients are international, and so there's two things about international trade. One is the business meetings and the personal connections, but they're all gone online now anyway, even if I could travel. And so it's kind of interesting to me. I don't see that. And the other side is goods. But at one level, what you can do is you could vaccinate the truck drivers. You know, there are things you can do. All of these things cost money, but they cost a lot less if you allow the domestic economy to reopen. You could test antigen testing every day at truck drivers that come back. So I'm all for solutions, and I think too much of this, yeah. So we just identify the problem and come up with something smart to allow us to do these things. I think the analysis shows the economic benefits are there. Will outweigh the cost of those measures if we can just organize ourselves to do it. That's my take. I'd be interested if our panelists have anything else to say on that.
Yeah, I would add that we understood through this lockdown how important supply chains are and how the economy is truly global. So if you cut off shipments from a country, all of a sudden your local manufacturing is suffering and you cannot even produce PP&E because you also cut alcohol production. So this is all of those things, the supply chains, and that's why when we worked on pandemic flu, we actually wanted to bring vaccine production to the US exactly because of that. Because prior to that, a lot of it was in Europe, but we wanted it to be local. So I think that's something that maybe the very essential industries you want to keep locally. So if you're forced to, to shut down, but at the same time, maybe we could look at the New Zealand example because they truly were able to isolate themselves. And that's where mortality actually fell by 11% due to the lockdown because, they have fewer incidents of pandemic flu and so on. And so maybe that's something that we could look into as well.
Yeah, not much to add on this. I mean, I think that both of you already made the point.
Yeah, great. So keeping the virus out does not necessarily mean keeping goods out. It just means managing it. So I'd like to call on Professor Jerry Killeen. I know he had a few comments here in our chat.
Thanks, James. Thanks, Anna. Thanks, Francesco. Wonderful talks. And I'm gonna, I just know from my own work in modeling that Mother Nature is often unsympathetic to the challenges of mathematicians, right? So there's limits to what we can do with maths, and then often we've just got to apply our own kind of brain power to extrapolate a little bit. So I'm just gonna throw a kind of a big picture question at you and see what you think about it. So, I think the challenges with COVID remind me of some things we've been wrestling with in my field, which is malaria, for quite some time. There's some things that we can do, and we know how to do, but the impacts are so transient, we don't bother. So, for an example, it's very easy to get to all swallow their tablets at one time, but of course, if they get reinfected by within 2 weeks, then all that impact disappears within a month. We're in a similar situation with COVID, in that what you did a month ago might not matter once you stop doing it. So just going beyond those kind of short-term impacts of relatively short lockdowns and thinking about, in our trade, what we call sticky endpoints. In other words, you end up at a sustainable endpoint that's much easier to maintain than it was to achieve. And so, like, elimination of it gets an awful lot easier. It's much easier to keep it out than to get rid of it. So in terms of the economic implications of those kind of medium-term endpoints that require a lot of patience, it's hard to stick with it when you're down to the last few cases, as we found out last summer. So thinking about those kind of medium-term outcomes, what's your broader thinking about that, Francesco, Anna, and James?
Well, one point is that the last summer we didn't have vaccines, though. No, so I mean, when infections were going down, the only tool we had were different types of restrictions that we were imposing as different types of lockdowns. The key difference now is that we have vaccines. We, depending on the country, we have been slower or faster in vaccinating people. What I think would be a realistic endpoint is, well, there is a substantial risk, and I'm not an epidemiologist, but the way I understand it is that there is a substantial risk that people get vaccinated earlier and then other people later. And when the people are vaccinated earlier, those that are vaccinated earlier can get reinfected later on. After, I don't know if it's a year or how long, it's not clear probably. So I guess that I was hearing talks about possibly having a coordinated shot in every country as a way, as a kind of a second round of vaccinations, which could provide a way to basically insulate the population and reduce the chances of further contagion in the future from people that were vaccinated earlier on and then got the virus later on. So that could be something to think about. And again, I mean, here I'm just speculating because I'm not an epidemiologist, but I think if there is a life to the first vaccine that we are getting, then it might be important to coordinate a second phase in which people are vaccinated more or less at the same time.
Yeah, I agree with Francesco. I would like to add, it's true that we're making a big push in the US, but it will be several years because before people in developing countries are vaccinated and the new variants will develop there. So with people traveling, it will be spread eventually back and forth. So I think we will just keep getting booster shots, and I think people will feel uncomfortable with large meetings for a long time. So I feel like things are not going to be back to normal for a long time, but maybe eventually through this coordinated vaccination, we should be able to suppress it sufficiently.
Thank you very much. Jerry, would you like to have anything on that point?
Yeah, I think it's really good to have a discussion where kind of all of us as epidemiologists, economists, you know, members of society, we're all talking about the uncertainties and those gray areas, you know, because there's been too much black and white conversation about vaccines. You know, it's going to be, they'll arrive and then everything will be fine. And the reality is that we're going to have to combine them with lots of things. And there's been a lot of evidence on the table this week. You know, you have a fantastic paper in the Lancet from Warwick showing that the UK will need more than just vaccines, even under the best possible assumptions, to get to sustainable elimination endpoints. And so we have to ask the question about that sticky endpoint. You know, is it worth taking it to its logical conclusion where you can open your pubs, you can have your rugby matches with your kind of boozy in the stands, arm around each other, singing songs and all that kind of stuff. The price you pay is you have to have certain controls to make sure that you kind of limit importations into the country, that, or between states, between counties, whatever it might be, and that if you do have an outbreak, that you throw a fire blanket on that. So we've got to trade off, I guess, the costs of doing that versus the costs of not doing it. And I was glad you focused on the importance of the supply chain for alcohol, because we're very fussy about that here in Ireland. And I'd like to see us to get to a sustainable, fun, messy endpoint where maybe international travel is a bit more difficult, and it will be for me, but most of our normal lives return. But that's a personal view. I'm guessing some of my ISAG colleagues might agree with me, but you know, the whole point of these meetings is to have a conversation. So I'd welcome alternative viewpoints.
Thanks, Jerry. I might just jump in here because we're an hour and a half in now and we need to think about wrapping up. But there is one important question. Christopher asked a follow-up question just to do with the length of lockdown in Ireland specifically. So this is not something that our guests today will be able to answer, but more that the people in ISAG might be able to look at. And I think this is an important one to talk about because it is the criticism that is thrown at the zero COVID idea. Again, the government this week repeated that going for zero would mean a longer lockdown, even though apparently the current one never ends. So what's longer than a never-ending lockdown? It's hard to say. And Christopher, the answer to your question is complicated because it depends on what the lockdown entails. So, and that's the variable. So we can make models that project if everybody does X, it will take this many days, but it depends on X happening. So it does depend on the government doing the thing. But the what we would argue for, and I'm happy for any of my colleagues to jump in here now, wave their hands, but what we've been arguing for is that, and it fits with what Francesco and Anna were saying in terms of the economic impacts as well, is that it's better to go on a stricter lockdown without the luxuries of that make it sustainable for long. We can, if it's long, we need some luxuries, but for it's a shorter time, we can do things without some of the luxuries of, for example, like, takeaway coffees and things like that, unpopular opinion, but it can be shorter. And I think, so that's the idea, to make it shorter, more effective, we get there faster, but it would be a bit harsher initially. Anthony, I think you could jump in here as well before we wrap up for the day.
Okay, very quickly. Yes, the evidence in lockdowns is exactly as Francesco and Anna have articulated, that stricter lockdowns lead to much faster reductions. The other point I think that's important for us here is that we've been very much a one-trick pony. We've been saying lockdowns will fix everything till the vaccines come along. And leaving to one side... We being
Ireland, I'll just clarify, not ISAG. We have...
So, parking to one side the question of whether the vaccines will actually fix everything or not, which is another question. What we haven't done is we haven't had a proper test, trace and track infrastructure. That's been our biggest weakness. We are now talking about introducing quarantine at the ports and airports, but only for a restricted number of countries, apparently to stop new strains spreading in Ireland. But in fact, the two most of the three alarming new strains, one of them is the dominant strain here, the B117 strain. And the other two strains, as James mentioned today, have both been spreading in this country in the last week. So one might fairly inquire, what are we doing? What do we think we're doing? Micheál McDowell, a man of whom I deeply disapprove for a range of reasons, but he has a good question in the Irish Times today, which is, what is the plan? This is something we've been saying for months. What is the plan? We are talking now about a lockdown that will run at current progress till August or September. That's the current plan. So we would argue that if we bring in a lockdown, bring in the other measures we've described, do it properly, we could substantially improve the situation in 6 to 8 weeks. Now, possibly not enough to be dancing at rugby matches with pints in our hands, but substantially better than it is now. And see where we are in 6 to 8 weeks of serious public health, a lockdown with a target and a purpose, pushing vaccination out as fast as we can and controlling the borders. And if we're somewhere good, that's fantastic. But we will almost certainly be somewhere better than we are right now. So.
Thank you, Anthony. A lockdown with a target and a purpose is exactly what we need. We are rudderless at the moment and it's not getting us anywhere. We're just treading water and staying in place. So yeah, we do need a proper plan from the government and we need proper interventions. So I think this is enough for today. We've been just over an hour and a half, and thank you to everybody who's been able to stay with us for that amount of time. It's a bit longer than usual, but we had some very meaty issues to discuss today. Thank you very much to our two guests, Francesco Grigoli and Anna Scherbina. You bring a wealth of expertise and we're really grateful that you were available to talk to us today. And it is, bringing this outside opinion and an economic analysis to this question was very useful. And thank you as usual to all of the ISAG panelists who are here to answer questions as needed. And we'll be back in our regular slot next week. Thank you.
Thank you.